Denise looks amazing. She's our A+ student looking for extra credit. She's done fillers before and she looks natural. She definitely wants to look natural, correct? Mm-hmm. Yes. So we've lined out the areas here. And Nina, can you get in a little closer so you can see? We've lined out the areas that's where we're going to build a tiny bit in the cheeks, around the mouth. We're going to do some in the temple and in the brow, and then the back of the jawline, a tiny bit. So we're going to be doing some of the bella fill, and we're also going to be doing some of the radius. And so thank you all for watching. Thank you for your comments. Now I've done a little bit of the numbing medicine, so I'm just going to test. Rest your head all the way back for me. I'm going to test. Now do you feel a little bit of a pinch here? Not too bad? Not too bad. So what happens is we numb the areas where we're going to insert, and then can you zoom in on those that are there, Nina? Mm-hmm. Thank you so much.
You're welcome.
So now that I've done the numbing in those areas where I like to, one of the places I'm going to start, I'm going to do just a tiny bit more numbing because I like to inject right into the skin through here. So let me show you what I do, where we take our little buzzer device, okay, and so you feel buzz, and then do you feel a little bit of a pinch here, Denise? Little pinch?
Just a little.
So a tiny bit of numbing. If you go slowly, try and make it easier than the dentist's office. So a tiny bit more numbing through there because we get that little hollow because of bone loss in the jaw. There's 4 basic categories. 1, 2, 3 pinch. We address. If we sag, we tighten. If we lose volume, we fill. If we get sun damage and wrinkles and sunspots on the skin, we polish and repair the skin. And the 4th category outshines everything else, and that's the power of smile. And Denise absolutely knows the power of smile. She's a great smiler, and none of our treatments look as good as Denise's smile, but we're going to help her look younger by filling in the volume. So we're starting a little bit with the bella fill. So there's the bella fill syringe, and it's a little 1/2 inch 27 gauge. So this is intradermal, so I just make, you have a good shot of that, Nina?
Yes, sir.
So for this type of injection, I like to use, and you can even prime it and see the tip of the filler right at the needle. So intradermal, and I do a little shiver when I inject. And why do I do that? Because it allows you to inject very small amounts of the product. Because if you're just still and you're pushing, sometimes you may push and get a lot. So the shiver technique is really great when you want to inject small amounts. What I've discovered is that when you are injecting hyaluronic acid, it's such an easy filler to inject that it's easy to inject it fast. And I think that's where people get into trouble because we always want to make sure that we're safe and you stay out of the blood vessel. So whether I'm still in some areas or I'm doing a little bit of the shiver, when I let me turn your head this way a little bit, when I really need to inject just a very small amount, I'll do the shiver technique. Now I like to dilute my Bellafill with 0.3 cc's of 2% plain lidocaine. And so there we've done just a small amount, 0.2 of a cc, and it allows us to fill in and thicken that skin in that area. Denise, how are you doing, dear?
I'm doing good.
Everything's looking good, so we keep it simple. We'll do just a tiny bit, little pinch here, 1, 2, 3 pinch. And the nasolabial fold, again, intradermal. And that's an easier injection where you can even see the skin almost reinflate when you inject in that area. So the shiver technique, I think, is really important when you're using a cannula because you'll place the cannula in many more areas around the face. So in through here, you feel pinch, 1, 2, 3 pinch. Feel big pinch, little pinch, medium pinch, not too bad.
Not too bad.
And even when you inject right away, I like to do the pressing massage. Immediately after the injection, you may see little swelling or tiny little area of fullness, and they all flatten when you're using very small amounts like what we're doing here. Pinch. We try and make it easier than getting a tattoo. So everything's looking good, and I always like to tell the patient, it's looking good, we're doing good. The #1 concern people have when they're doing fillers, they don't want to look unnatural. So here I'll use a little bit of the shiver, even if especially if you feel a little resistance on the syringe. The additional benefit of the shiver technique is when you're trying to stay out of the blood vessel, let me tell you, it's very difficult to get into a blood vessel and stay in a blood vessel or inject into a blood vessel when that needle is moving. It's just technically very hard. So that I think gives you some additional advantage for safety. So I did a little bit through there, through the melolabial fold. Now I'm going to do a little bit more here into the nasolabial fold, pinching, and a little withdrawal. When I dilute the Bellafill, it allows me a little more leniency to withdraw. A little pinch here, 1, 2, 3, pinch. Sorry, that's a little pinch. And Denise is doing great. She's such a great patient. Thank you so much. And thank you to our team, Nina and Elise, for setting everything up perfectly. So I like to recommend a 5-minute massage 5 times a day for 5 days. Afterwards, I'm going to make the insertion point where I'm going to, that's just the entry point, where I'm going to do a little fill into the brow. We are so proud of our team here, and they do such a great job taking great care of me and our patients. Pinch. Denise, how are you doing, dear?
I'm doing good.
Very good. We're very grateful here in Florida that we did well through the weather. So now this is the cannula, okay, and this is again Bellafill. So are you feeling any pain right now, Denise? Over here you felt small, medium, big pinches. What did you feel?
Small.
Small, right. So someone made a comment, they said that looks painful. And you know, if you can keep it to small pinches, most people, they do just fine. It's the rare patient that I have that requires relaxing medicine. I can do that for you, you just need a driver. So this is the twist technique. So I use the twist. You feel a little pinch there? Notice how I'm stabilizing the skin with my fingers. Twist, 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 twist. You're just anterior to the superior orbital rim. Little pinch there. So she'll feel a little bit of a pinch, and if you twist, you just can get past that little area with minimal discomfort, so it's good for, you know, if you bump the cannula into a blood vessel, it's painful, it's uncomfortable. So if a patient tells you, hey, that's painful in that area, you want to pay attention to that. So I did about 1/10 of a cc. Once you inject into an area, you hydrodissect it a little bit. So now you give yourself a little more space. You feel a little bit of a pinch there, Denise? Not a little bit? Okay. So I'm going to do another, I'll probably do 2.5 of a cc through this area. And then Denise will feel this get a little bit more numb. So the twist technique allows you to be as atraumatic as possible as you are advancing the cannula. So that's about a little less than 0.3. Now once I've injected that, I like to take some extra time to really push on the brow and make sure, and I can flatten all that up against the orbital rim. Denise will pass the grocery store test today. If she's walking into the grocery, no one's going to do a double take, right? So that's important because fillers are the future of plastic surgery. There's no downtime. I'm going to turn your head this way just a little bit. The results look natural. We have long-term fillers. You feel a little pressure, pinch, pressure, pinch. Feel a little pinch there? Mm-hmm. So I'm subcutaneous in the temple, and once I've done that twist technique to place it now, I love the Shiver technique to just making sure you're doing fine, tiny amounts of that filler over a large area. That was less than 1/10 of a cc that I just injected in a very small amount. Now I'm going to make another pathway fanning technique. Do you feel a little pinch there, Denise? Mm-hmm. So she feels a pinch, so I'll be very delicate there. Oh, she feels that there, so what I do is I stop, I withdraw, and then I'm going to hydrodissect a little bit by injecting some of the product and injecting numbing medicine so that it numbs, and that it gives you more of a space to advance later. So do you feel a little pinch here?
Yeah, right there.
How about here, a little pinch?
A little bit, yeah.
So we've placed, she feels a little bit of the pinching, but nothing extreme. And so then I also massage, as you can see, as I'm injecting. So it's fanning technique. Here, here, here. Now I'm going to go back, a little more posterior. Can you get a good angle there, Nina? Do you want to come on this side so you can see it?
I'm right on it, if you want me to stay right here.
All right, Nina's the camera person. She's taking good direction. And so everything's looking good.
Someone asked, what is this product?
This is Bellafill, and we're going to be doing some Radiesse as well. Combination Bellafill, combination Radiesse. So far I've injected about 7/10 of a syringe, 7/10 of a cc. You feel a little bit of a pinch there, Denise? Mm-hmm. I've seen people inject with needle in the temple, and I really don't feel it's as safe. I think it's safer to use the cannula in this, and you know, as you can see, really no significant bleeding of any sort. If you have some bleeding from the vein, or you see a little collection of blood, you can hold pressure and it goes away. It resolves very quickly, but you obviously have to stop your injection and hold pressure while that resolves, and it does not impact your long-term result. So you obviously want to be careful in this area. Feel a little pressure, a little pinch. You feel a pinch there, Denise?
Mm-hmm.
Big, little, medium pinch?
A little.
Okay. Everything's looking good. You are going to love it. Pressure, pinch, pressure, pinch, pressure, pinch. And so I'm putting this last little bit, and you feel a little bit of a pinch there?
Mm-hmm.
And little pinch?
Little.
How about right now? Nothing really?
No.
So, okay. Now, Shiver technique to make sure you're in a safe place, safe distribution of the product. So that's one syringe. Now, again, I'm going to follow that up with some massage. It's looking good. Thank you for watching. We're in Tampa, Florida, in the Villages, Florida. You can look us up at imagelift.com.
Are there any side effects?
So as we talk about with all fillers, there's risk of undercorrecting. If we undercorrect, you can always come back and put more in. Risk of overcorrection. You go conservatively to avoid that. Mm. And so the difference between here, she's got a little bit less of the hollow. We're going to treat on this side. Raise your eyebrows up real high. The numbing medicine, as you can see, the numbing, you can relax. The numbing makes it more difficult to raise on this side. So it's numb. Perfect. And what I'm going to do, I'm going to turn your head this way. Annalise, can you just hold some pressure right there? We'll hold a tiny bit of pressure just to help, tiny bit of swelling. That's perfect. Thank you so much. And so, perfect. And I believe I made the little entry point right in through here. That's where we're going to place the cannula. We're going to do the same thing on this side. So it really can be this simple and straightforward. This is an advanced technique. So you certainly need to feel very comfortable with fillers before you do something like this, but it does make you, I'm stabilizing the skin. I find the insertion point. Now I'm doing the gentle twist, 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 twist. So Denise, do you feel little pinch, medium, big pinch there? What do you feel?
A little.
So little pinch, twist technique, twist, twist, twist. Very gentle, very delicate, feather touch. Little pinch there.
Mm-hmm.
Little pinch. You're doing great. Big deep breath for me, in and out. Thank you so much to Denise for allowing us to do some teaching. We have people from all around the world, doctors, students, that are learning our technique. And as you can see, as I'm injecting, I use my smart finger to guide the injection and also feel. It's like our little ultrasound sensor. I can sense and feel and know where the cannula is. Very good. A little more of the Shiver technique. Sometimes when you're injecting, you feel a little bit of pressure on the plunger, and the product can come out a little more easily sometimes. Sometimes you need a little bit more pressure. Do you feel a pressure pinch there? Not too bad?
Not too bad.
Okay, good. Very good. Denise is being an excellent patient. She's got a great result, and we have patients are coming in when they're younger because they don't want to wait until they have more advanced aging changes. So Denise does not look her age, and she's doing maintenance and prevention, and thank goodness fillers truly are the future. You can help yourself look younger, no downtime, natural results, and long-lasting results. Now, little pressure pinch. How about now, Denise? Do you feel a little bit of a pinch? Not really?
Not really.
Perfect. The brow deflates. I think a lot of surgical brow lifts are overdone because when we're young, the position of your brow is actually quite low. So again, I did about 0.3 of a cc in that area. Now I'm massaging, pushing it up against the bone there. Now you can relax as best you can. Now I'm going to come across the temple because we hollow in the temple, and any place that you see a hollow is a sign of aging for us. So pressure pinch, pressure pinch. You feel a little bit of a pinch there?
Mm-hmm.
So you do the twist technique to position the cannula, and then you're going to, I do withdrawal. You do a little bit of hydrodissection when you're gently placing the filler, and I can feel it. I can feel it as the filler is injected. I can feel the tiny, tiny little bulge of the filler. I'm going to push and massage that down. Feel a little pinch there?
Mm-hmm.
Okay. Small, medium, big pinch?
That was a medium.
That was a little bit more, so we'll go slowly. So you do feel some pinching, but as you can see, for the most part, it's very tolerable. Now, I tell patients if they need a break, to let me know. But most patients say, that's fine, you're doing good. Do you feel a little bit of a pinch here, Denise?
Mm-hmm.
Small, medium, big there?
Small.
Okay, good. A little bit more? Okay. And sometimes you know if the patient feels small, medium, big just by how they respond. You can say they don't flinch, you feel a little pressure pinch. If they flinch a little bit more, you know that's in the medium or the larger pinch category, so you just need to make sure that they're comfortable. Reposition your cannula. Make sure, withdraw, make sure that you obviously don't want to inject into a blood vessel. So now I find the spot, I twist. Going a little posteriorly, you want to inject to the hairline. Pressure pinch. You feel a little pinch there? Mm-hmm. Pressure pinch, pressure pinch. You're doing great. And this area does get more numb. Patients will say that they feel a little bit more numb under the cheek, pressure pinch. And so you feel the resistance, and you want to be gently overcoming that resistance. It's looking good. Do you feel that a little bit more numb on this side?
Mm-hmm.
Do you feel any pinching or pain on this side over here?
Not now, no.
Okay, perfect. Which is what we expect. So it's always good to over-ask how the patient is doing. They appreciate it. It's good to have that communication, and it helps your injection technique, I believe. Pressure pinch, pressure pinch, pressure pinch. And when you tell the patient what they're going to be experiencing, gives them a little bit more confidence that you know what you're doing. Because in their mind, sometimes the patient will say, am I supposed to feel that? Am I supposed to feel this? And if you tell them you're going to feel this, and they say, okay, we're on the same page. So as long as you keep the sensations tolerable, then they'll move along with you. And little pinch there or not really?
Not really.
Pressure pinch, pressure pinch. So like I said, this is more of an advanced injection technique. You can get comfortable injecting nasolabial folds and cheeks. And once you do a little bit here and there, I definitely prefer the cannula to the needle in this area, in most areas around the face. I think just for primarily a safety factor. So at this point, I've got about another 2/10 of a syringe, and I want to massage through this area. I'm going to hold some pressure through here. I'm going to do just a little bit more, a little bit of swelling there, but we're going to massage, and that massage helps to reduce some of the swelling, and it also helps to spread out and evenly distribute the product. Perfect. And as you can tell, I like to be vigorous with the massage. Some of that is the numbing medicine. Some of that is a tiny bit of swelling. Some of that is the product. But the massage overall does a good job to distribute and put the product where you want it to be. You feel a little bit of a pinch there or not really?
No.
Perfect. Looking good. And I can even feel the cannula advances more easily after I've made those first few passes. This is a subcutaneous injection. I've heard people say, hey, the safest plane is under the superficial temporal fascia, and that may be true, but I think technically it's very hard to get to that plane. So we did a little across through here, a little on this side. Now what I'm going to do is I'm going to turn your head to this side, and at least I'll have you just hold a tiny bit of pressure on that side. Thank you so much. And then we still have some of the radius that we're going to use. We did some around the mouth. Now what I'm going to do is I'm going to use a little bit through the cheek, and we're going to do the back of the jawline as well. So this little spot right here, just double checking my little insertion point, and we'll do an insertion point through here as well. Sometimes I'll project the chin. Pressure pinch, pressure pinch. Feel a little bit of a pinch there? Mm-hmm. Again, twist technique to help you as atraumatically and gently as possible advance your cannula. I tell patients if they feel they have a little puffiness in the cheek, afterwards it's very uncommon that you use a Medrol dose pack to reduce swelling. So that's less than 1/10 of a cc that I'm advancing there, that I'm injecting. Shiver technique keeps you safe. Placing the cannula. You feel a little pinch, medium or big there, Denise?
Probably medium.
So she feels a little bit more. The numbing medicine is going to start to settle in. This is across the zygomatic arch. So a tiny bit, and I'm injecting with my pinky as I'm shivering here. Shiver technique, and the shiver technique is handy too. If you actually do have a tremor, you just tell the patient you're using a shiver technique, and they think that they're like, oh, well, they must know what they're doing. So you're doing fine. And you can make your patient smile. If you make them laugh too much, she's not moving too much. You're not going to disrupt what I'm doing. Okay, you're doing.
For you.
No, you're fine. You're not going to. Because that's always a favorite thing for a doctor to tell their patient that I've got a tremor, but don't worry, I'll do a great job. Shiver technique. Okay, so that's about half of the syringe there. I'm going to put a little bit more radius just a little bit later. So I did there, just to build up in the cheek. And look how natural she looks. She can pass the grocery store test today. And you can even though I'm not done injecting, why don't you take a look. Can you see how it fills in gently? There's a tiny bit of swelling. As I tell patients, you don't want to taste the chocolate cake before it's done baking. It's not quite ready yet. But Denise is a great patient, and she's doing things the right way. Maintenance and prevention is better than renovation. I'm going to turn your head this way just a little bit. So we find the little insertion point, and then I use the twist technique to advance the cannula. And sometimes you do have to put a little bit of pressure, especially when you're going through that dermal layer. And once I get through, you can kind of feel it. And we're getting there, almost there. And I use that twist, and so we got through the dermal layer. Now I'm just doing fine, and look how easily it slides. Do you feel a little pinch there? Big, little, medium pinch? Not too bad?
Not too bad.
So I'm just using a fine amount. It is very difficult to get into trouble with fillers when you're injecting by 1/10 of a cc or 1/2 of a tenth of a cc, 0.05 cc's, and you just do those fine amounts over a fanning technique. It always keeps you safe. And low injection pressures, know your anatomy. Everything's looking good. You feel a little bit of a pinch here?
A little bit, yeah.
Are you able to see that there, Nina?
Yes.
Pressure pinch. So again, now I'm using my shiver to just put very, very, very fine amounts of the product. Now that's mostly you want the apex to be over the zygoma. But what I'm going to do is I'm going to do some just right under the zygoma as well. And so twist technique, twist, twist, twist. Denise, do you feel a little bit of a pinch there?
A little bit.
Just a little pinch. We're in the home stretch, just a little bit more to go. So now I'm just right, a little pinching, and I can feel that. When I feel resistance, she's going to feel some pinching and pain there too. So we try and twist through that now. I'm going to do, even though I didn't get all the way through, I want to do a little bit of numbing, and I'm going to put a little bit of product there. I'll take a little bit of a different angle. Pressure pinch, pressure pinch. Here's what I'm going to do. I'm going to come from this side. The little insertion points heal, and I've never had a patient come back to me and say, you know, that insertion point stayed with me. It always goes away. It may take a little bit longer, but usually within a day or two you don't see it anymore, which is a good thing. I'm going to do a little bit centrally. The orbitomalar ligament attaches here, so we tend to get a little bit of a hollow. And so now I'm just adding volume in that natural place where we get a reduction of volume. Everything's looking good. So patients can see when you're doing fillers, and so here I'm using, it's kind of a shiver technique, but I'm going up and down because this is a very safe area, no major blood vessels. So here I just love to kind of spread the product around and moving things. That's a different little variation on the shiver technique, but you want to stay in motion because it's hard to be in a blood vessel and it's hard to stay in a blood vessel when you're in motion. So we've got this one here. Can you put that together for me? So then I'm just going to do a tiny bit of massage. Perfect. And then we'll wipe off these areas because I want to make sure Denise looks good, which she does. Make a big smile for me, big smile. So the smile still looks natural. Now relax as best you can. I'm going to do just a tiny bit through these areas, and we're going to do some in the back of the jawline and just a little bit in the cheek. Thank you so much. And in between, we wipe the cannulas with some alcohol Some people ask, they say, well, do you clean out the cannula? I do like to freshen that up with a little bit of the alcohol cleanse. We also use Hiba cleanse. You feel a little pressure pinch here?
Mm-hmm.
Pressure pinch. Okay. Another little 1/10 of a cc, just a little bit here and there. 1/10 of a cc there. So you want to use very small amounts, and you can go back and forth and just check your different angles, check the shadowing, check the lighting, ask the patient, show them the mirror, say, do you like it? Do you want a little more here? Do you want a little more there? If you're uncertain, it's always better to just come back another day and do more, right? You're not in a hurry. Once you do fillers long enough, everybody starts to say the same thing. They say, well, don't you have something that lasts a little bit longer? And we do. That's the Bellafill, long-term filler. The polymethyl methacrylate is a long-term filler that is non-absorbable. The collagen gets absorbed and replaced by our body's own collagen. But the PMMA gets covered by our body's collagen.
Is this a way to fix the face wrinkles?
It does help by reinflating some of the face wrinkles. So this is a variation of the Shiver technique. So as you can see, I'm kind of just moving up and down, up and down, up and down to really disseminate that over a large area. Now what I'm going to do is we're going to use some for the back of the jawline. And again, I'll go slowly there. So we made the little insertion point. I'm going to use some of the, I'm going to turn your head to the side nice and easy. So now I'm using a little bit of the radius. And so Denise, you're going to feel a little pressure, a little pinch.
Is the patient in pain?
Are you feeling any pain right now?
No.
Okay. I believe her. You know, it's funny, sometimes patients will say, well, I didn't want to say anything. Mm-hmm. You know, and, you know, I always tell patients, tell me if you're feeling discomfort. You can usually tell, but like I said, it's very rare that a patient needs relaxing medicine. And if they need it, we'll do it for them. So, Shiver technique. And I love the Shiver technique because it allows me to put a very fine amount of the product over a large area, and I do believe it keeps you safer when you are wanting to avoid blood vessels. So I did 4/10 of a cc through the back of the jawline, and again, I like to massage and push and just make sure, you know, you can't really hurt the product, and you may see a little bit of swelling. I'm going to turn your head this way. Good. And again, Elise and Nina have everything set up perfectly for me. I'm so proud of our team. I'm going to turn your head this way a little more.
How long will this product last?
The Bellafill is non-absorbable. The Radiesse lasts for about a year for some people. Some say a year and a half. Some say 6 to 9 months. Do you feel a little bit of a pinch here? A little pinch?
Nothing yet.
Okay. So we've already numbed there, so that's the entry point for the cannula. Very good. So I'm just going to add a little bit more through there. I like to stabilize myself. I put my leg up against the chair here, so I'm going to this side so I can, you know, come down and make sure I've got really stable positioning. Pressure pinch, pressure pinch. So once I am in position, it's just a little easier for me to use my left hand through here. So I'll get that angle, and I put that's about 1/10 of a cc of the Radiesse. I also mix my Radiesse with lidocaine. They're both already mixed with lidocaine, but I add a little extra to reduce the viscosity and to make it easier to spread the product in very fine and small amounts. So I like to dilute the fillers a little bit more. That's just my preference.
Someone asked if you gave any anesthesia to the patient.
I gave some of the lidocaine, tiny bits of the lidocaine, so we use local anesthesia and we use vocal anesthesia. And a lot of patients, it is very calming to hear your doctor describe what they're doing, right? Do you feel that way?
Yeah, definitely.
And so, turn your head this way. So patients, when I do the videos, they're like, that was really great. You did a great job. I enjoyed hearing you. They said, I would not have thought to have asked that question. So patients learn when we do videos because they're a part of the experience, and you can hear it in my voice. You know, you don't want your surgeon to say, oh my gosh, you know, what's the, right, you know, but if she can hear, I feel confident, I feel good, I'm very happy. to her, she's saying, is he's happy, then I'm happy. We're doing good. So what I'm going to do is I'm going to have you look straight ahead just like you're talking to someone there. Okay, thank you very much for your comments, right? And so I'm going to do just a touch more through here. She looks good, and I look at all the angles. We look straight on. I like what I see in the cheeks. We want to go slowly and not do too much. I'm going to turn your head back here and then back, so I'm just going to add a little bit more here and there. You can do it in increments. You should check your angles and lighting. So again, I use the twist technique to get into position. I use the shiver to really help position. And now that I've already injected in that area, it's much easier to inject. It moves more easily. I can advance the cannula. Do you feel pain there, Denise?
Not pain, no.
She'll feel the pressure, so it's even more comfortable for her. She may feel a little pinch here and there, but now that I've injected and hydrodissected and numbed a little bit, now it's a little bit easier for her. So we did another little 4/10 of a cc. She wanted to strengthen the jawline. We lose bone. I tell patients you can feel the brow, feel the cheek, you feel the bone that's there.
Mm-hmm.
The back of the jaw, the chin. We lose bone as we get older. We get a little bit shorter. And let me turn your head this way a little bit. And the bony prominences in our face erode. Twist technique, but it's so much easier now for me to place that. So as I'm pinching with my finger, my middle finger I'm using to press on the plunger, and I'm using the shiver technique. So this is an advanced technique. Do not try this unless you are an advanced injector. Okay? We are very proud. We have patients come from all across the country, internationally, and we're proud to share. I was in Chicago a few weeks ago sharing my techniques on over 6,000 syringes of Bellafill. I'm going to be in Phoenix in November to share what we do with the Bellafill as well, and also we'll be talking about live video in Miami, and again we'll be back in Vegas in the summer. So I've got just a tiny bit left and we are almost done. You are doing great, Denise. Denise gets a prize for doing she's really very generous to allow us to share, and she's being a great patient, and she has a great result. And even more important than all of those things, she's got a great smile. So we have some eyes for her. Great. Let me turn your head this way. She knows the power of smile. I can help people look younger, and if they want to look more attractive, they gotta smile. But if they want to look even younger than what we can achieve with the cosmetic treatments, then you just have to act immature. So everything's looking good. Some of the videos, the viewers, let me turn your head this way, they make fun of me, and it's really funny because I love to say it. I love to say everything's looking good because it's true, but I want to say it in a way that makes my patients feel good. I want them to feel good, and it is true. Everything is looking good. So a little shiver technique, just a tiny bit left in through this area. Do the little twist to position the cannula. A little bit more through here. Okay, now we're completely done. Turn your head here. So I'm going to do some massage through these areas. Denise will absolutely pass the grocery store test. She looks good. A little bit of swelling. If a family member or friend saw her, they would say, yeah, you got a little tiny bit of swelling, but have a look in the mirror. So can you see how it fills out in those areas?
Mm-hmm.
How does it look so far?
I like it.
Okay, and that's the most important thing. As long as Denise is happy, we're good, and it's going to be better. And I usually take pictures at 1 month. Now the lidocaine keeps the brow from lifting up as much just because of the numbness. So, and what I'll do is I'll show you really quickly. Here are her pictures where Denise she looks great. So you can see here. Here's where we started. She looks really great. She just wants to do a little bit of volume. So we plump and fill through the jawline. So you see her here, and then you see her here. How it still looks natural. A little bit more volume. Make a big smile. So you did great. Congratulations.
Thank you.
I'll give you a hug.
Thank you very much.
All right. So thank you everyone for watching. Let us know if you have questions. ImageLift.com. Dr. Rich Castellano here. I'll say goodbye. All right. Goodbye, everyone. Until the next video. Okay. You did great. And